Hello everyone, my name is Jaskiran Kaur. I'm a nursing student at Indiana State University in nursing 444 class, and this is my project for community health nursing. It's regarding the obesity. So first of all, just pause right here and then do the attached pre-test. Then you can continue the learning objectives. The learning objectives are people in the community will be able to understand how to tell if they are obese or overweight by calculating the BMI, that is a body mass index, and what are the causes of obesity, what are the complications that can arise from being obese, and when to go see a doctor for health concerns. So, what is obesity? It's a disease that involves excessive amounts of body fat. It is a medical problem that increases the risk of many diseases such as heart disease, diabetes, and high blood pressure, etc. So, in this picture, you can see how those, like if you eat one burger, two burger, three, and four, so like the amount of junk food you eat, so that's how you get obese. And then it often results from taking more calories than we burn. Um, and then body mass index calculator. So how you calculate that? You can calculate by the formula that's shown here. It's BMI is equal to weight in kilograms over height. And then it will tell you if you are obese or not. And then, according to the World Health Organization, there's a classification of that formula. So, if your BMI is between 18.5 to 25, then you have a normal weight. And then, if it's between 25 to 30, then you are overweight. And then, BMI between 30 to 40, you consider obese. And then, if you are above 40, that means it's a morbid obesity. So it also shows there the associated risk. So there's a normal, average, important, and then severe risk according to that formula. And then here are the causes of obesity. So there are many causes of obesity. Um, there is like overeating, of course, that's a main, when people just continue to eat. And then environmental factors does contribute to that. Medications, family history, lack of exercise, genetics, pregnancy. So there are a couple of obesity causes. Common causes of obesity: inactivity. So when people have a sedentary lifestyle and they are not active, they get obese. They don't burn calories and they continue to eat. Like you can see in this picture, he's just laying down watching TV, and then there's like a lot of junk food around him. So he's not active, so that's the cause of obesity in him. Um, Diets. There are some bad habits that contribute to obesity. That includes eating late night, skipping a breakfast, junk foods, etc. So in this picture, showing like the Coca-Cola burgers and fries, so they are all junk food, and they're also fast food that causes obesity. Pregnancy. Many women gain weight after delivering babies, especially when they have multiple pregnancies, and it's very hard for them to lose weight. So if they don't lose weight, or at least try to lose weight, they become obese. So it's like permanent obesity if they don't want to lose weight at that time. Lack of sleep. Lack of sleep also contributes to obesity because there are many changes in hormones and then disturbances in body hormones that cause obesity when you don't sleep good at night or you don't take naps. Um, there are some medications that contribute to weight gain, that includes blood pressure medications, diabetes, steroids, antidepressants, antipsychotics. So there are a couple of medications that can cause obesity. There are some medical conditions that can also cause obesity. Um, some medical conditions and syndromes that contribute to gain weight, that includes Cushing syndrome, that's shown in this picture. So there's like a normal picture of that baby or boy, and then there's the other one that shows on the right side, Cushing syndrome. So how that syndrome makes that baby obese. And then the hypothyroidism, it also causes obesity. Arthritis, paraplegia, so that also contributes to obesity. And some people, like no matter if they how they eat or how they how their lifestyle is, but they're still obese. So the genetics um, can be the cause. So our genes play a huge role in obesity. No matter some people try hard to lose weight, but because of inherited genes, it is very hard to control weight. So it's just like runs in the families. If family members are obese and their kids are obese, so it's just like genetics. And in this picture, there it's shown the two different body shapes. So on the left side, it's an apple, and then the right side, it's a pear-shaped body. And then it also shows like above the waist difference, then below the waist difference in that body shapes. Family lifestyle. Family's lifestyle contributes to obesity. So when people in family eat unhealthy foods, their children follow them and start eating unhealthy food. So like whenever kids see their parents eating junk foods, and then they want to try, of course, and they just like get used to it. So yeah, family depends on the family how they eat and how they teach their children to eat. Culture and lifestyle in many countries are different. So, like every culture is different, and then their lifestyle is different, and then what they eat um, in their daily life. So, that causes obesity too. Age contributes to weight gain, of course. The amount of muscles in the body tends to decrease with age. In this picture, is shown how that man, like with age, he is obese. With age, normal the hormonal changes and a less active lifestyle increase the risk of obesity. So most people like when they get old, they like even they were skinny before, and then as they age, they start increasing weight. So it depends on their body muscles. And here are the complications that can arise from obesity. That includes type 2 diabetes, heart disease, high blood pressure, certain cancers. That includes breast cancer, colon cancer, endometrial cancer, stroke, gallbladder disease, fatty liver disease, high cholesterol, sleep apnea, and other breathing problems, arthritis, infertility. That's the all the complications from obesity. When do you think you need to go see a doctor? So this picture shows the doctor is measuring his abdominal. There's a measurement. So, and it is very important to see a doctor when your weight keeps on increasing and you start having health concerns. You can discuss your diet and other health concerns with your provider, and ask about like what are the treatment options that can help you lose weight, and then so you don't get all those diseases that I mentioned earlier. So it's very important to keep track when you're obese or if you're gaining too much weight and you need to see a doctor. How to control diabetes? Um, so there are many diet changes you can do, like eat healthy fruits, vegetables, and then fiber. So not no junk food, etc. And then exercise and activities. So you can do exercise, like just keep a daily routine, like you want to do exercise this many minutes daily, or how many times a week you want to do it. And then activities, so just like stay active. That will help control diabetes. Um, And then weight loss medications. Um, Weight loss medications that can help you to lose weight. Surgery, that's the other option to control obesity. Hormonal treatments that that can help you to lose weight, and then you can treat the hormones, and then that can help you lose weight. Behavior changes. So some people have behaviors like they just continue eating, and then it's just their behavior that they just want to eat. So that needs to change if you want to control your obesity. How to raise awareness in the community. So how you can tell your community um, to stay healthy, and then don't get obesity. So we need to encourage families to make small changes like keeping fresh fruits within reach, or going on a family walk after dinner, increasing the amount of physical activity through physical education and extracurricular activities. So we just need to make our community aware of what are the activities that are available, especially for our kids, so they don't gain weight. Improving access to outdoor recreational activities. So I know it's hard in this pandemic, but we need to have more outdoor access so people can go out and then do some kind of activities. Health awareness programs. So there should be a programs like every month, every week, so people know like what to do, or then how can also how they can take care of their health. So there should be some kind of awareness programs to just keep people motivated. So are our children obese? So obesity is not only in like adults, but it's like in children too. So it obesity is in children is very common problem nowadays. So this is very cool picture that shows if your kids are obese or overweight, and then they can become overweight adults. So kids, like they need to parents need to teach them like from beginning about the obesity or what to eat, so they won't become overweight when they get in that when they age. Um, this one is a picture that shows eat right. So there's like a fruits, vegetables, grains, and multigrains, and all those fibers. So just say get your plate in shape. So we need to make sure we watch the amount of food we eat. This one shows eat meat and vegetables, nuts and seeds, some fruits, little starch, and no sugar. And they say fitness in 100 words. So just like this picture just mentions everything, like we need to eat healthy. There are some facts about overweight and obesity. Some recent World Health Organization global estimates follow. In 2016, more than 1.9 billion adults aged 18 years and older were overweight. Of these, over 650 million adults were obese. In 2016, 39% of adults aged 18 years and over, that includes 39% of men and 40% of women, were overweight. Overall, about 13 percentage of the world's adult population, 11% of men and 15% of women were obese in 2016. The worldwide prevalence of obesity nearly tripled between 1975 and 2016. And this is a link that I got this information from. And here are the references from where I got that information, and there's a link to go.